Welcome to the Kaleidoscope, Healthcare in a Diverse America, from molecule to market, with your host, Sheila Thorne. Each episode highlights healthcare leaders and patients of color to discuss culturally, linguistically appropriate strategies and services. You can find this show on all major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Now here's the host of the Kaleidoscope, Sheila Thorne.
Hello, and welcome to the Kaleidoscope. June is National Public Safety Month. You might find it strange to talk about public safety and public health in the same episode, but living in safe neighborhoods is one of the social determinants that is a great predictor of outcomes, health outcomes, and health access. So we are now going to have a conversation with two individuals who have been charged uniquely with keeping neighborhoods safe. And we'll find out what they think about whether health figures into that. There is no doubt that the inequitable burden of mental and physical harm on socially marginalized, economically disadvantaged communities creates violence, creates crime. Poverty, unemployment, poor educational resources, homicides, robberies, sexual assaults, domestic violence, hate crimes, drive-by shootings. Unfortunately, all of these things are unique to disadvantaged communities of color, and that has occurred far too often in our lifetime. In fact, in 2017, the American Public Health Association declared violence a public health crisis. But in order for you to really get a picture of what that means, think back to May 25th, 2020, when a 46-year-old African-American man by the name of George Perry Floyd Jr. was murdered in the streets of Minneapolis by a white police officer. He was being arrested on suspicion of using a counterfeit bill in a local store. After the officers pushed the 6-foot black man to the ground, handcuffed him behind his back, the white officer shoved his knee in George Floyd's back and neck for 9 minutes and 29 seconds while he cried out 27 times, "I can't breathe." Communities surrounded this incident, and unfortunately, a young 17-year-old African-American teenager by the name of Donnell Frazier took the liberty of recording most of this incident, and she was with her 9-year-old cousin. Not only did they watch the life drain out of this man who cried out, "I can't breathe" 27 times, but who eventually cried out for his deceased mother before he died. That incident sparked a global response in terms of people who are outraged at police brutality, social injustices in the community, and it reverberated around the world. Ms. Frazier, now 21 years old, continues to have nightmares about what she witnessed in that 10 minutes. The community bystanders, one of which who called the paramedics to come, still suffer, and they testified on the trial of Derek Chauvin, the police officer who was eventually charged with second-degree murder and now is serving 22 and a half years in prison. Not only did Ms. Frazier suffer, but her family suffered as well. They created a fund, $630,000 for her to get mental health. She lives with thinking there's a target on her back all the time. And when she looked at George Floyd, she saw her uncles, her brothers, her cousins, her father, and she couldn't stop crying. She testified at the trial, as did many of those community bystanders. So you don't think there's a connection between law enforcement and public health? Well, I'm here to tell you, I'm not the expert, but I'm going to bring on two experts who can solidify that point. I'd like to welcome to the episode today, Commissioner Jiles Ship and Detective Raymond Ramos, retired from NYPD. Welcome, gentlemen.
Good evening, and thank you for having me. It's a pleasure to be here with you, Ms. Thorne.
Well, I'm delighted to have you. And Ray Ramos, you're currently in Florida. And Jiles Ship, where are you in the world today?
Somewhere in international waters, coming back from the Bahamas.
Okay. All right. Well, I thank you both for being my guests on the show today. That incident that I described in my opening remarks, I think, made everyone well aware that communities of color suffer disproportionately from crime and violence. And it doesn't just end with the perpetrator, it also has effect on the officers as well. Unfortunately, the system leans heavily on you, law enforcement officers, to keep the peace. In fact, there's sometimes you refer to you as peace officers. And so you are charged uniquely with that responsibility. I want to hear what you think about that, and what we can do as a community to help others who may be not only in these communities, but suffering from diabetes and hypertension and cancer and HIV, on top of living in unsafe neighborhoods. Detective Ramos, I'm going to start with you. Where did you serve in New York City when you were part of the NYPD?
Well, I served in the Housing Bureau, which was in various New York City housing developments in Brooklyn, New York, East New York, Brownsville, Crown Heights. In the latter part of my career, I served with the with IAB, Internal Affairs Bureau.
Mm-hmm. Well, let me just say to the audience that Detective Ramos served in the New York Army National Guard. He served in Bosnia during Operation Noble Eagle, and he served in Iraq during Operation Enduring Freedom, and then joined the NYPD. Detective Ramos, what was it like serving in those communities? Was it always peaceful? Was it always safe?
Well, one of the fortunate things I was able to experience was the fact that I grew up in East New York, Brooklyn. So I kind of came home, East New York and Brownsville. And so I knew from the civilian perspective what my upbringing was like, how I grew up. I used to say it all the time. We all have post-traumatic stress disorder because it's not normal for us to experience some of the unfortunate things that happen in our neighborhoods growing up. It's not normal to hear gunshots and without even opening your eyes, you just roll to the floor until it all stops. And so when I got an opportunity to serve back in Brooklyn and in my community, I kind of knew what the other side felt like.
Okay.
So I had a different view of the community. It was more of like, how could I serve? How could I be more of an assistance to the community and get involved and be that officer that kind of had to enforce the law, but also knew what the community was like.
And did you see how violence had an impact on the residents of the communities beyond the perpetrator and the victim? Did it have an effect on the community?
It always has an effect on the community because, people are working hard. There are hardworking people that live in these communities, and they have feelings and concerns. And when things happen, I remember one incident with a young lady that went to a party in one of the housing developments on a midnight tour. We responded to gunfire, and the young lady was at a party and she got shot. And just getting her to the hospital and that whole chaotic scene, I can see just the destruction and just the heartfelt sorrow of just seeing her mother when she got to the hospital, and her mother just wailing upon hearing that her teenage daughter did not make it, and she just collapsed into my arms, and I can feel the hurt, and I know what it's like to feel that because growing up, you see this happen, and it has a lasting effect on everyone.
Certainly, that's a horrific experience. Well, Commissioner Jiles Ship has over 30 years of experience in law enforcement on the federal, state, and local level. Early in his career, he was assigned to community policing units and was responsible for organizing several community-oriented police initiatives and neighborhood watch programs. He investigated a myriad of bias and hate crimes and certainly was in undercover operations. Based on what Detective Ramos said, Commissioner Ship, do you identify in the same way with what happens when violence occurs in these communities?
Absolutely. I mean, that's something that people just take for granted. But that's trauma that people in those communities. I grew up in an underserved community, so I know from both sides,
Okay.
from growing up in one and from policing in it. And that trauma stays with people for the rest of their life. But unfortunately, the larger society doesn't see that way. You know, it's almost became now, unfortunately, socially acceptable for that to happen in certain communities. But we cannot let that continue to occur. As you said earlier, you know, this is truly a public health problem.
Yes.
And this is just not me saying it or you saying it. This has been determined by the National Institute of Health.
Mm-hmm.
What is let me also to the impact of even on the perpetrators and the
Yes.
communities of color. You know, findings indicated that persons of color were disproportionately impacted by violence, non-Hispanic, African American homicide victims, suicide decedents, and the homicide suicide perpetrators died 11 or more years earlier than their non-Hispanic white counterparts.
Wow.
So
Wow.
you know, those are the facts. You know, and as
So,
I said,
the George Floyd incident was not an anomaly. This is something that goes on in marginalized communities all over the country on a daily basis.
absolutely, but unfortunately, it's the point now where, you know, it's not reported out on as much because, as I said, some people say, "Well, that community, these things happen all the time." You know, so it's not really that type of news that the larger society is interested in hearing.
You're absolutely right. I mean, I think I heard a report about this store owner who actually called the police on George Floyd is suffering mental illnesses, and he thinks it was his fault that that man died. So it even goes beyond, you know, the victim itself. Detective Ramos, how did you, as a law enforcement officer, deal with seeing these heinous, egregious?
Absolutely, and also too, another point is too, those law enforcement officers who work in those particular communities or in those particular municipalities or cities,
Yes.
they also internalize a lot of this mental anguish and trauma. That's
Exactly.
unfortunately, it's never, in a lot of cases, not dealt with properly.
Well, that's what I wanted to talk to Detective Ramos about. Ray, what do you think? How did you cope with watching this stuff on a daily basis for over 20 years?
It was difficult because in law enforcement you have a difficult job. You are a public servant, so your responsibility is to protect and serve, and you want to be able to do it effectively. When incidences like the George Floyd incident occurs, that is a lot of pressure on us as law enforcement officers because, you know, we're trying to do the best that we possibly can to serve communities of color in any community. And when this happens, it kind of just makes us have a step back. You know, we're trying to gain the trust of the community, and these unfortunate incidences happen, and it begins to create sort of like a divide within the department itself, because, you know, there are those of us that feel for the situation that happened. There are those of us that are trying to do the job the best way we can, and now we have to now deal with the pressures. There's also the anger aspect of it because I'm going to be realistic as a person of color. You know, what reverberates in my mind is that we have to stop treating communities of color as a training ground. We are sworn in to protect and serve all communities, and just made me feel that why are communities of color always heavily policed as other
Yes.
communities? So it creates a divide. You're not human if you don't have any feeling or thought on the situation. You cannot be that naive to say, well, you know, we have a job to do, and that we're always right. We're not. You know, you have to be real about it and understand that sometimes, you know, in law enforcement, there are mistakes that can be made if you don't understand the why. The why is important in everything that we do in life. But when you put on a badge and you are sworn to protect and serve, you better understand the why. And that means that you have a job to do in all communities with all people, and everyone is to be treated fairly. So with me in regards to that, I had a lot of mixed feelings going in, because I say, here we go again. We now have to undo a situation that has happened. Of course, you always have to run the course that you don't just run to conclusion right away, but in the back of your mind, there is a pattern, and the pattern that needs to be addressed.
Fantastic. I mean, the Detective Ramos served in the National Guard. Commissioner Ship was a member of the United States Marine Corps from 1981 to 1987. So Commissioner Ship, has that training enabled you to really embrace community policing in a different way?
Well, I think what that does, in addition to, I mean, it kind of hardens me to kind of deal with certain situations. But the thing of it is that, like I said earlier, I am of those communities. So when I see people in the community that are suffering from any kind of mental anguish or trauma, I look at it, I put myself in their shoes, because I can identify with them. And it's makes it easier for me to address those issues and have another level of sensitivity towards those individuals who are going through that trauma. So it's critically important. But one of the things are too, as I was saying earlier, even me as a law enforcement officer, there's not many services that are out there for law enforcement officers. There's more now than there were when I started in 1985.
I was going to ask you about that. Yeah.
Because many law enforcement agencies offer what's called EAPs, Employee Assistance Programs. But it has always been this big stigma around it. They used to call it the rubber gun squad. If you went up and you was having troubles, you was having mental health issues, they would right away take your weapon and put you on what we call the rubber gun squad. And that would stigmatize you. So many people would not come forward because of that stigma that goes along with reporting it. And it should be a very confidential thing. But I can tell you it wasn't like that. A lot of people have went up, and some people unfortunately have went to the level of suicide when they had problems, because they didn't want to report it to the agency, because they didn't want to become stigmatized. But now we have a number of things out. One of them are, we have peer-to-peer counseling. We have a good program in New York with Rutgers University called Cop to Cops. So there you can get on the phone, you can talk to other peers that may have had similar problems as well. And they have that, they provide that service now also for people who are returning from the military as well. So you have the program for cops now, and then you also have it for the military. And in New Jersey, we also started a officer resiliency training, in which providing resiliency training for all New Jersey law enforcement officers. And it was made mandatory now. So all law enforcement officers have to have this training. And there's actually a chief resiliency officer in the state of New Jersey now. So there's much more now than there were when I started. But we still need to do more, because there's still a stigma around it if you come forward and say you're having a mental health issue.
Well, you see people on the worst days of their lives. You may be summoned to a hospital because there's a suspicion of domestic violence or child abuse or rape or an assault. What kind of interaction have you had with healthcare professionals and healthcare facilities, Commissioner Ship? Have they been receptive to what you have to do in your job compared to what they have to do?
I'm sorry, Ms. Thorne, I missed the first part of that. You froze.
Yes, I was saying that you have come into people's lives on the worst day of their lives. You're summoned to a hospital, suspicion of domestic violence or suspicion of child abuse. What has your interaction been with healthcare professionals?
Yeah, well, see, that's the thing too. When people always forget, people call the police when everybody's at wits end. Nobody else wants to deal with it, so let's call the cops. Dial 911. And that's not really our primary function.
Okay.
Main responsibility of law enforcement officers are to enhance public safety, primarily through investigating suspicion of criminal activity, also apprehending and detaining of those individuals suspected of criminal offenses. That's our main. I know all the time you see on police cars, protect and serve, but that's not our primary function. Now we will help. We've got calls from everything from cats up a tree to people being mutilated by a spouse or someone else. But our primary function, as I said, is to investigate, apprehend, and detention of individuals suspected of criminal offenses. So,
well, have you interacted with doctors in the healthcare system whenever you have a case or you're summoned to keep the peace, etc.? Have you had interactions with healthcare professionals?
Yes. Well, now we have we have a new program in New Jersey. It's called New Jersey Arrive, and it's where you partner a public health professional along with a police officer if the person who the call that we're responding to may be going through a mental health crisis. Now the police officer will show up with that person, and Arrive stands for Alternative Response to Reducing Instances of Violence and Escalation. It's community informed and designed to fit the specific needs and resources of each community. So Arrive improves the health and well-being of individuals with mental and substance abuse behavioral health emergencies, and it eliminates the stigma by improving how law enforcement officials respond to members of the community experiencing mental and behavioral health. In New Jersey, we have found that a great percentage of those who have got killed in quote unquote questionable shootings by law enforcement officers were also suffering from mental health issues. And we weren't doing anything to address that, but now we have this program and it's going throughout all 21 counties now in New Jersey. We piloted it in 3 counties and we believe it's successful. Time will tell, but at least we're doing something, working with the community and community health experts to address that issue.
Wonderful. Detective Ramos, I'd love to hear your experience because you're retired now and you're still actively involved in community, in mentoring young men of color and in making sure that we can prevent these incidences. Both of you are still actively engaged. Why do you do that?
Well, for me, on my half, it was part of me being involved back or being entrenched back in the community. And then back in 1995, as a beat officer, I came across a program called Imani Altissimo, which was in East New York. And it was run by 2 gentlemen, Brother Battle and Brother A.T. Mitchell. I believe A.T. Mitchell is the gang liaison for Mayor Adams. So when they started that program, I would come and volunteer my services just so I could get to know the community. Kids would get to know me, young people get to know me, and I can kind of get the pulse of what's going on. Because Jiles and myself shared, we were on one side growing up as civilians, now we're on the other side. We used to have a whole thing in Brooklyn. Once you leave Brooklyn, you ain't from Brooklyn no more. So I got involved with that program. It's now called Man Up. I'm still involved with them. I help them send kids off to camp every year to get them off the streets. And it spurred me to start my own organization in 2005, just so I could help young men evolve in their growth and leadership responsibilities. Because many times in the inner city communities, sometimes we're a part of the problem. We're not part of the solution, and we want to get out. Once we leave, we're gone and that's it. And so this gave me an opportunity to help young men understand the why. And when they understand that, to take ownership of where they live. And as they matriculate out, then being able to come back and help the next young man coming up. So that's always been my passion. In the department, I was a part of PAPA, which is police officers providing peer assistance to help officers in trouble and respond, because working in internal affairs and even in my own precinct, we had 2 officers that committed suicide. 1 officer, 1 lieutenant. And so it gave me an opportunity to help try to curtail some of the issues and pressures that we face each and every day. 20, 30 year, 25 and 30-year careers is a long time of trauma.
Yes.
That people don't understand, that you kind of internalize and you take with you to the grave many times. So being involved with PAPA and IAB, I could tell you at least 10 suicides that I had to respond to.
Wow.
And so that's 10 too many.
Absolutely.
Interactions with medical professionals is, my interaction with them is to gather as much intel and information for them. So when we responded to the hospital with, say, a rape kit,
Mm-hmm.
or we responded to the mental health facilities, we used to call it EDP responses, emotionally disturbed person responses. And we would have to escort them to the mental health facilities and sit with them until they got their services. So
Mm-hmm.
our initial interaction with that particular individual was vital to the mental health community, because they want to know what that person said, what that person, if they were on medication, how
Mm-hmm.
much medication they were taking. So a lot, I call it a front row seat to everything. You have to be everything as a police officer sometimes. The
I can
community
hear that.
police, law enforcement, sometimes temporary medical professional, whatever it takes until it's handed off is on your plate.
Well, I know, Commissioner Jiles, you are a professor at Rutgers School of Criminal Justice. And what do you see with the law enforcement officers coming up in the ranks? Do you see that they are really cognizant of the need to get in community like you and Detective Ramos has done for success?
Well, let me be candid. Not enough, and it's not pushed enough by administrations, because community policing is something that works. It's
Mm-hmm.
not me saying it. There's empirical data to support it from the Department of Justice. But what has happened over the years is kind of became perverted, because what community policing really is a philosophy that promotes organizational strategies that support the systematic, use of partnerships and problem-solving techniques to proactively address the immediate conditions that give rise to public safety issues such as crime, social disorder, and the fear of crime. Now,
Mm.
out of that, a part that has been missing for the longest time, and a lot of people didn't even start talking about it till George Floyd, was the health side of the problem,
Uh-huh.
the public health part of it. We've always had, initially when we started it, we've had corporations come to the table because they had a vested interest in making sure that people did business in town. So we had
Yes.
corporations come to the table. We had other city offices come to the table. But I can tell you, up until recently, we haven't had the health department from the city come to the table, which
Huh.
is critically important. What they did in one city in New Jersey, in Newark, they created, now it's going throughout the state, but they created CITs, crisis intervention teams, which
Mm-hmm.
provide officers with 40 hours of extensive training to respond to calls involving someone suffering a mental health crisis.
Mm-hmm.
And so it really works. And not only are they, and these are primarily teams driven by members of the community.
Yes.
So they already have trust in those communities, so people are more apt to deal with them. So I don't care what initiative you start, if it's not driven by the people in the communities, it may be a hot item for a year or two, and then it'll fade away.
Oh, there
I've
you go.
worked for
There
6
you go.
different attorney generals. I've worked for 2 different chiefs, and I ran a law enforcement agency myself, Plainfield, which is a mid-sized urban center. And I
Mm-hmm.
can tell you this: grants and things come and go, and sometimes these initiatives stay as long as the grants do. But the
Mm-hmm.
ones that are more sustainable are the ones that are driven by the community. And those
Uh-huh.
that are driven by the community, usually we usually get the best results from.
It's not surprising, and that's the philosophy that I've always had in healthcare: outreach and engagement. You got to have boots on the ground, feet on the street, and if you are of color, you have an advantage, but sometimes that can be used in a negative way as well.
Mm-hmm.
Detective Ramos, you're a member of the National Latino Officers Association, and so your spirit, I'm sure, has permeated that organization in terms of who you are and what you do. Prevention, what's the key? Commissioner Ship just said that it's not just police. You've got to have everybody at the table. What do you suggest would stop the violence and keep the peace?
Well, prevention takes a mindset of a willingness that people want to see things effectively change.
Mm-hmm.
And it's understanding of the communities and what the communities of color deal with on an everyday basis. There's a lot of things, economic, social, mental health things that impact the communities. And a lot of times we don't pour enough resources into dealing with that. We kind of use a Band-Aid approach. So it takes, from my opinion, it takes a willingness on all parties to want to serve. When you say community policing,
yes,
the big word is community. That means all communities, and understanding what the communities are. When you go through the police training, they want us to understand every community that we're going to come into, whether it be Jewish, Islamic, Hispanic, but how much emphasis is really placed on actually the knowledge and understanding of what you're about to encounter, and being able to effectively serve those communities without bias. I'm fortunate in that, yes, I am from a Latino background, but my grandfather was from Curacao, so I have a Caribbean background. So I understand all cultures. My grandmother was from Puerto Rico, but her grandmother spoke French and was dark skinned. So you can only imagine what ship she came off of. So if I've had the willingness to understand cultures and being able to look at communities as people, hardworking people that need to be served, whether they're at the lowest threshold or they're at the upper echelon, being able to look without bias and understand that you have a job and you have a responsibility to serve.
Exactly. And Commissioner Ship is past president of the National Organization of Black Law Enforcement Executives, one of the premier institutions that have members from the federal, state, and local level of law enforcement. He's also currently president of the Noble chapter in New Jersey. So I know these two gentlemen have been on the front lines for a very long time. They've been involved in police reform issues. The George Floyd Policing Act, Jiles, I think that's still sitting on the president's desk, isn't it? I think he froze. Well, I think both of you have given us a bird's eye view of what it's like to live in a safe neighborhood and your efforts in keeping peace in neighborhoods that are marginalized, that are threatened with all kinds of external forces. Yes, there are some sociopaths out there, but by and large, much of what happens in these communities is because of poverty, is because of living desperate lives and trying to make a living and to keep the peace. But in order for health to be all-encompassing, we need everybody at the table. It's been my privilege over the last 10, 12 years to work with the nation's premier law enforcement agencies of color and their role that they play in public health as we strive for health equity. So I'm going to thank you, Detective Ramos, and thank you, Commissioner Ship, for sharing with us your personal experience, and you make us feel safer just listening to you. So we know that the Derek Chauvins of the world may be few and far between, but they have an impact. The Floyd family is still suffering. They received a $27 million lawsuit for wrongful death, and the Officer Chauvin is serving a sentence. I don't know if that's justice. Certainly it helps to ease some of the pain, but you'll never replace the loss of a father, a son, a brother, a sister. All of those things keep these communities traumatized and marginalized, so that health is a primary factor in order to make them feel whole, especially mental health. So thank you, Commissioner Ship. Thank you, Detective Ramos. And we look forward to continuing to work with law enforcement to keep our neighborhoods safe.
If I can just say one more thing before you close out.
Absolutely.
Yeah, we get nowadays more so than before. We get more training with diversity. We get more training with bias crimes. But an area that we really need to delve into is cultural competency training.
Yes.
Which provide critical skills for law enforcement who may be working with populations whose backgrounds are different from their own. And that's critically important, that you have cultural competency. I mean, diversity, we now pretty much know what diversity is, and we, accept diverse people, but to have that level of cultural competency, and if I have enough time real quickly, I was going to a job, my part of the day happened to be Italian American. We was going to a big festival. It was like a San Gennaro festival, big celebration in the Italian section of town. And one of the guys on our squad was ready to go up there, jump out the car, and start ordering people around. And we told him to back off, let Joey handle this. And Joe went inside. He talked to the head organizer of the event, and he says, "Can you give me a half an hour? I have everything shut down, and we'll be on our way," because we was dealing with a noise ordinance. So we said, "Yeah, no problem." Now, if we'd have took the other guy's approach, who has no familiarity with that community, that could have turned into a full-scale riot, because the people that we were dealing with, first of all, they had been drinking all day, and they had this macho thing in there, and they had their ladies out there with them. And we came in trying to just order them around. I can tell you firsthand, it wouldn't have ended well. So that's what I'm talking about. But he had the cultural competency and knew what was going on, and is familiar enough with that community, so he can go out there. I think he made the wisest decision.
Excellent example. And you and I and Detective Ramos have talked about cultural competency, and we are engaged in training law enforcement and healthcare professionals who need to do a better job. And it's like the words of Dr. Benjamin F. Chavis Jr., who said, "I'd rather work with the police than be chased by the police." Yes. So we need to have you all at the table to keep our communities safe, to keep our communities helpful, to keep our communities healthful. And so clearly, we thank you both, not only for your service in the military, but also in your service on the ground in terms of law enforcement. It is not just your responsibility to keep neighborhoods safe, but you're a critical part that needs to be at the table. So thank you both again, and wish you well and continued success in your work.
Thank you for having me.
I'll see you, Sheila.
You're welcome.
All righty.
You've been tuning into the Kaleidoscope, Healthcare in a Diverse America from Molecule to Market, with your host, Sheila Thorne. You can find more episodes on all the major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others.